Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Hello, everyone. Welcome to another edition of the Empowering Plans Podcast. I'm your host for today, Brady Bizarro, and joining me, I think for the first time ever on a podcast, our senior attorney in provider relations, Brian O'Hara. What's going on, Brian?
Thank you, Brady, for having me. I appreciate it. Really excited to do my first podcast today.
You know, it's a good topic that you're joining me for today because it could be the last podcast real humans ever do. We'll see how far the technology takes us. But we're talking today, as you know, about artificial intelligence. In particular, we'll talk mostly about ChatGPT. That's the kind of software that's been in the public domain and literally and figuratively for the last couple of months. And funny enough, today, Brian, the Senate Judiciary Committee has started hearings on this very topic. I think the title of the committee hearing was Oversight of Artificial Intelligence Rules. It wasn't like we don't have rules yet, but it was more like, should we have rules? And funny enough, the hearing started with the chairman of the committee, Senator Blumenthal from Connecticut. If you were listening to the audio of the hearing, you wouldn't be able to tell this, but he actually played introductory remarks that were recorded by ChatGPT, synthesizing his voice. Basically, it wasn't him, and he didn't write the comments, he didn't speak the words, but when he played it for the people in the audience, at the end he said, actually, that wasn't me. So obviously we knew that watching him, but he literally asked ChatGPT to construct a transcript of opening remarks that Senator Blumenthal would make on this topic. And then they had some other software that could literally do voice synthesizing, and it just sounded just like him. So it was pretty freaky.
Well, thanks, Brady. That's not frightening at all.
Exactly.
I appreciate those remarks.
I mean, honestly, probably one of the weirdest ways to kick off the committee hearing, but really effective because the senators went on to talk to the CEO, the founder of ChatGPT, about the possibilities, the uses of the software, and obviously, most importantly, the risks associated with it. And there are quite a few. And some of the questions were pretty scary about, obviously not just the fact that this technology could displace millions or maybe even billions over time jobs, right? But that there's some really insidious uses that it could be targeted at. And depending on who gets their hands on this technology, or really once it gets sort of beyond what they call in the industry escape velocity, where it's sort of out of anyone's control. It begins to learn on its own and becomes what I think in the lingo is called artificial general intelligence. We don't have that yet. It's like AGI, where essentially it can solve any problem and not just focused on beating someone at chess, for example, or a detailed task. We're still at the phase now where we have some control over where this goes and what happens. But I thought what we do before we talk about how this impacts healthcare is give a quick summary for those of you in the audience who might be thinking, I've heard all about this ChatGPT, OpenAI. What the heck is it? I think I know, but I don't really know. So just a quick summary of what it is here. So a chatbot is a software application that mimics human conversation like we're having right now. For all you know, we actually are a chatbot. You don't know if we're real people, but assume that we're real. And I'll go on and say that it can perform a wide range of language-based tasks. So you can ask it questions, it'll give you answers. It can summarize large volumes of information, and it can complete text. It can write things from scratch, almost anything. Google has a competitor called Bard. I think Meta has a competitor as well. There are others out there, but those are the two primary ones competing with ChatGPT, which is OpenAI software, meaning that the source code has been released to the public. And that's why you're seeing some really rapid advances in different versions of ChatGPT. I think now we're on version 4, which came out in March. I'm sure in a couple of weeks, there'll be version 5, which is leaps and bounds, probably more effective than this one. But here's some interesting stats about this. It can now pass the bar exam, I assume in every state. It can pass the U.S. medical licensing examination. So that's what doctors must take to become licensed as physicians. And large hospitals like Boston Children's Hospital are actually hiring ChatGPT experts, which is kind of a portend of things to come, perhaps. So I guess for our purposes today, we want to talk about some of the major areas we think this technology can disrupt healthcare. There's quite a few. In one article we found here from New England Journal of Medicine, kind of identified 5 topics. And really, each one of these could probably make its own podcast. But for today, I'll just go over the 5 briefly, and then Brian, I'll kick it over to you to go in depth on the first one here, which is perhaps in some ways the most interesting. So the first way that ChatGPT can be utilized or leveraged in the healthcare space would be to act as a virtual assistant for patient care. So it could literally be used to create a virtual assistant that can interact with patients, helping them to schedule appointments, answer their medical questions, and provide information on symptoms they may be experiencing, and even suggest treatments. That's one. Two would be clinical documentation. So it can be used literally in the creation of documentation, medical charts, progress notes. That would be an important function for it to assist with. Third would be medical research, another huge area where in many ways, we've been frustrated by slow progress in advancing scientific knowledge in treating certain diseases, despite large amounts of government funding. So you could see some, superior intelligence literally applied in that area. Medical education. So this is where it could be functioning alongside medical students and maybe even practicing physicians now to supplement their knowledge or enhance it, or again, synthesize and summarize large data sets for them in real time. And then finally, patient engagement. So providing patients with real-time feedback and support to self-manage their care. In some ways related to the first one on virtual assistants, but perhaps more on the back end is what we have in mind there. So on this first one though, virtual assistants or patient care. So what are the kind of things, Brian, that you found when you looked into how this could play out in terms of impacting how patients are receiving their care today?
Certainly. Thank you for leading into that. So healthcare, especially direct primary care, has increasingly been moving towards digital visits and telehealth, especially since the COVID-19 pandemic. I know that I personally communicate with my doctor regularly through Patient Gateway. There are other hospital systems that use MyChart or other types of patient portals. Healthcare providers have expressed concern about keeping up with demand and being able to respond to their patients through these portals in real time while also being able to see their patients in person. And AI seems to be kind of a perfect fit for these situations. I recently read an article by Megan Cerullo on CBS News titled "Question for Your Doctor: Artificial Intelligence Can Help." And this article delved into a pilot program that physicians are using at UC San Diego Health and UW Health. They've been testing a tool since April that will automatically draft responses to patients' queries about things like their symptoms, medications, other medical issues like that. Now, it's important to note that the tool doesn't automatically respond to patients. So it's not a situation where a patient can put in a prompt and then get a response right away. What happens is the patient will put in a response. It'll go to MyChart. The AI bot will actually produce a proposed response that a doctor can either edit or delete, or they can send it outright. And the goal really is to help cut down on the time doctors spend on these written communications so that they can focus more on complex tasks and to attend to their in-person visits. One thing that I actually found funny is that the article cited a study published in a journal, JAMA Internal Medicine, that found that many patients actually preferred responses from ChatGPT. They found that not only was the information better, but there was more empathy. There was better bedside manner from ChatGPT.
That's interesting. I read an article I saw recently is related to this as well. I think it had to do in the context of the Surgeon General had issued a notice about loneliness in the US and what could be done to cure that problem. And one of the solutions I saw pitched was using artificial intelligence technology like chatbots to sort of have patients communicate with and to keep them company. And apparently, if you think about how these technologies have been developed, where they're just literally learning human behaviors and syntax and how to communicate with people, I'm not kind of surprised in some ways that it learns how to be empathetic, right? And so that's in some ways not surprising to me. I think some doctors might be a little upset by learning that. But one of the things, and we can talk about this a little bit more perhaps later, but one of the issues I see there with interacting with a chatbot is, should you have the right to know that you are in fact interacting with an AI bot as opposed to an actual person? Because I could see in some contexts, maybe a company wants to keep that information hidden. And maybe for some patients, if they thought that it was an actual person, they'd feel more comforted perhaps than knowing it was an actual artificial, machine. Or in some cases, can the interaction the patient's having be manipulative in some way? Can the chatbot be persuading you? I know there was an article I read recently on this topic as well, and there's really dozens out there. Apparently, there was a couple of prompts given. I don't think it was ChatGPT, but another similar chatbot where a patient was actually convinced to end her own life because of what she was receiving in terms of information from the chatbot. She was basically explaining, her hopeless situation. The chatbot agreed with her that, yeah, you should probably just end it all. And really an unfortunate situation that those are the kinds of guardrails that you want to put in place before you have these technologies interacting with patients.
Absolutely. I think you hit the nail on the head there. We have to remember that AI is still in its infancy. Chatbots can, basically hallucinate, if you will. They can give wrong answers. They can give completely random answers. And in, very unusual cases like the one you just cited, it can give tragic answers. And that's kind of why in this particular study, they made sure that doctors were reviewing answers before these answers actually went out. There are other potential issues as well. I think at this point, the advice that these bots like a ChatGPT can give is pretty limited in scope. They can give some basic answers, but detailed answers on a patient-specific prognosis or the best course of care, certainly that's still going to be within the realm of your actual live human physician's expertise. There's also security and PHI issues as well that really need to be worked out. With those issues in mind, there are many in the industry that are kind of realizing that patients communicating directly with ChatGPT or bots, that might be a bit premature right now, especially in more complex cases. Similar to how Googling symptoms online just isn't enough to treat your condition. I think we've all done some doom scrolling on WebMD, looking at our symptoms and, convincing ourselves that we have every condition under the sun. Chatting with a bot might just not be enough for your healthcare. I recently read a blog post by Dean Levitt. It's entitled 100 plus ChatGPT prompts for healthcare professionals. And in this article, he discusses how providers themselves can utilize AI to generate reliable and comprehensive responses to provide to patients. So, rather than a patient communicating with a chatbot and getting a direct communication back from that chatbot, a provider could actually input a prompt into ChatGPT to come up with an acceptable response for their patient without having to spend the time actually composing it. Some of the tips for providers that he had put on there were, clearly stating your expectations and requirements for the chatbot's response. So like format, word count, things like that. Using open-ended questions to avoid yes or no answers. Providing background information to help the chatbot understand the subject matter. There were a number of proposed prompts in there as examples. I just chose a couple here to quickly review. So an example might be, if you're explaining a medical condition and treatment, a provider might input this prompt. Summarize the causes and risk factors for whatever medical condition. Create 3 concise explanations with a maximum of 100 words each. And in that case, the provider would be able to get a quick and succinct letter written that they can send back to their patient without having to spend the time doing it themselves. They had one, we talked about kind of empathy and bedside manner earlier. They had one on empathy where he suggested that they write 3 empathetic and supportive messages for patients who have received a serious medical diagnosis, whatever that medical diagnosis may be. Each message should be no more than 200 words. So you can see where providers might be using this to be able to improve their bedside manner when they're communicating with their patients. But these are the kind of prompts I think that providers are going to be using. I think that this is how, at least at this stage of the game, that providers are going to best utilize AI and these chatbots in terms of patient care. So rather than having these chatbots communicate directly with patients, using them to create their own answers.
Yeah, Brian, what you described, I think, is what we've seen as well in the legal community and perhaps in other industries as well, where these technologies, this in particular ChatGPT, is being relied on as a tool to supplement existing expertise, or it's being used to do a lot of the ground level legwork, if you will, to produce the beginnings of an answer. And then you have someone review the response to confirm that it was correct, that it wasn't hallucinating, making up facts, or in our case, making up case law, which it's been known to do as well. But the truth is, this is what was discussed in the hearing in the Senate as well today, is this is moving very quickly. And so I think we're not too far away from not needing to have someone review, no one could give a firm answer. Is it months away, years away? It's kind of like when someone has that breakthrough, right? There's no telling how it will play out, but we're not there yet. And so what I would say for us and for our clients who may be dabbling with these technologies, whether you're a stop loss carrier or your MGU and you're looking at how this can supplement your underwriting activities, or if you're doing claim reviews or looking to identify potential cases of fraud, write a plan document, review a contract, whatever it may be, you need to make sure that you're keeping professionals in place to do some quality control, right? Even though this is a superior technology in many ways, it can recite much more quickly than certainly I can, case law, or give you a legal rule. Or if you're a physician, I think I've already seen many cases it can read things like mammograms better than the best doctor can. And that's only going to get more true as time goes on. But for our purposes in the self-funded industry, and considering the fact that we have not just ethical obligations, but fiduciary obligations, you've got to make sure you've got that control, that final check in place in the form of a professional who can do the final review on whatever it is that you're sending out to make sure that you're not unintentionally allowing the chatbot to deceive you.
Absolutely. So I've actually had some discussions about AI with our Senior Vice President of Provider Relations, Scott Bennett. I'm sure many of our listeners are familiar with Scott, and I've kind of made the statement half joking, half serious, hey, won't be too long before all of us lawyers are replaced by ChatGPT, huh? And his response has been that ChatGPT is not going to replace lawyers, but lawyers that don't start using AI and don't get in on things like ChatGPT and don't know how to use them, they're going to struggle. So, and I think that the medical community is probably seeing it as the same way. And the medical community is not going to be replaced by AI, at least not anytime soon. I certainly hope. But certainly, I think everyone in the medical community is realizing that this is kind of the new normal, and they're going to need to utilize AI moving forward in their practice.
Yeah, and companies who don't utilize it are going to fall behind, right? They're not going to do as well. They're not going to be as profitable or as efficient. And we're don't really have a choice anymore. And that's one of the things that the CEO of ChatGPT mentioned today in the hearing, is that this technology really is revolutionary. It's a new industrial age in many ways. And he kind of gave two different scenarios on how this could play out, which is kind of humbling, but also very alarming. He said this could either be like the advent of the internet or the advent of the nuclear bomb. It's like, in terms of how scary this could be and how it could either go really well or really bad for humanity. And that's really not an overstatement. So in our slice of the economy in this healthcare industry, things are going to move quickly, and make sure that, again, you're staying up to date on these technologies. If you have questions about them, or you want to see how other vendors in the industry are interacting, reach out to us, because we've gotten questions on this topic quite a lot. And as I mentioned before, there's a number of areas that this will impact. And so we will do future podcasts on this topic for sure as things develop, and things are moving very quickly. So hopefully you stick around and hear what we have to say and our thoughts on these other areas of healthcare as they're sort of impacted and disrupted by ChatGPT and other competitor products. So I think on that note, a good start for discussing AI, more to come in the future. So thank you, Brian, for joining me for the latest edition of the Empowering Plans podcast. Thanks again to Pat, the man, the producer, always behind the scenes. One day, Pat will probably also be a robot, but we're not there yet. So on behalf of myself, Brian, and Pat, I want to thank you all for listening, and we'll see you next time. Take care.